It's very good for pregnant women having lots of pain, mostly at the back. Are exercises on your hands and your knees. Now, you can do these exercises on the floor or on the bed. So if you have difficulty getting off the floor, if you think you're going to have difficulty getting off the floor, then just do it on your bed. Okay? So with this one, the starting position would be your hands under your shoulders, shoulder width apart, and your knees under your hips, hip width apart again. So you're starting with a flat back, like a table. And what you're trying to do is just very gently letting your head come down. And then you imagine you're trying to press your back up towards the ceiling. If you can, try and hold this position for about maybe 5 seconds or 3 breaths, and then gently coming down again, back to the starting position. Avoid too much of a dip when you come back down. Okay, so let's try and do that again. So gently letting your head down and then arching your back up towards the ceiling. Holding it for the count of 5, very gently breathing in and out, and then coming back. Okay, so if you can manage about maybe anything between 3 to 5 of these stretches, it's really good. And you can do it once a day, maybe even twice a day. If you've been sitting around doing some work on your computer, it's quite nice mid-morning or mid-afternoon coming to do a bit of a stretch. Another stretch that's quite nice for the muscles around the back of you, especially towards your buttock area, is what we call the baby or the fetal position. So with this one, you will need to have your knees slightly apart to try and accommodate for your bump. And you need to kind of walk your hands slightly forward. For some women, you might have to kind of place a little pillow behind your knees. And what you're trying to do is you're trying to kind of bring your bottom as far back as you can to try and sit or rest towards your heels. Okay, so gently resting, and again trying to hold this position for about 5 seconds or a little bit more if you can, breathing, and you get a very nice stretch to all the muscles at the back of your bottom. Okay, and then very gently, after you've held that stretch, coming back up. Okay, so we're going to just do that one more time. So very gently coming right back as if you're trying to sit on your heels. And sometimes you can even get your head resting on the bed, depends on how big your bump is. So, and then breathing in and out, trying to hold that for at least a count of 5, and then coming back up. And then you can bring your hands back